Hello, this is Adrienne Payne-Andrews, and I would like to welcome you to the Healthy Communities Initiative webinar, Making the Case for Policy Change. This afternoon, Marrow and Natasha Frost will start a two-part series about how to make the case for policy change to increase access to healthy foods and active transportation opportunities. The second part of the series will be presented by Tammy Bradley and Vera Bosner on December 11th, and will focus on how to frame policy messages for your community. On the line today are Sean Brown with Kansas Health Foundation, Mary and Natasha with Public Health Law Center, and Vicki and Claudia with Healthy Kids Challenge. Mary and Natasha will begin the discussion with a slide presentation and allow time for questions at the end. During the last 30 minutes of the webinar, from about 1 to 1:30, Claudia will introduce a couple of resources and share some ideas about how the information can help actions around the community change framework. And she'll also invite questions and feedback regarding SharePoint. Just a few housekeeping items before we begin. As with previous webinars, all of your lines are muted. If you have not keyed in your audio PIN, please do so, as that allows your line to be unmuted later. If you have a question, please type it into the box on the right side of your screen, and Sean will read the questions at the end of the presentation or throughout as it makes sense. Finally, the webinar is being recorded and will be archived on SharePoint. Sean, do you want to go ahead and welcome the teams?
Sure. Good morning, everyone. And again, I want to welcome you to today's webinar. Jeff is out at a conference today, so he's not able to join us, but he is here in spirit. So, and again, I just want to thank you for your participation. Mary and Natasha are no strangers to you, so no further introduction needed in that regard. But I am looking forward to their presentation. It promises to be a real treat. The other thing, as Adrienne mentioned, is as opposed to our normal networking time, Vicki and Claudia will be sharing with you some additional information and resources. We also will have additional time in terms of if there are more questions that you have for Mary or Natasha, we can handle those at that time as well. So with that, I would like to turn it over to Mary and Natasha.
Great. Thanks, Sean. This is Mary, and I just wanted to say hello from Minnesota. I hope that you all are having a warmer day than we've been having recently, and we're really happy to be here talking to you about how you make the case for policy change. And as a little background for this webinar, we came up with the idea from this webinar really based on calls and discussions that we've been having with your leadership teams and with several of you individually, where some questions and some requests have come in to asking for some information and some assistance in talking about why policy change is important in your community and how to really make the case for policy change as you are moving your policy initiative forward, gaining support in your community, building momentum, that some people are having some questions about why you're actually pursuing this. And I think that it's really important to recognize that everyone in your community may not be familiar with this idea of policy systems and environmental change. I think that it's something that, I know even 3 or 4 years ago, I wasn't that familiar with it until I started working more closely in public health initiatives, and I feel like it's kind of public health speak, talking about this kind of a concept, and people in your communities may not be that familiar with it. And we're hoping that this webinar will provide you with a tool to talk about policy systems and environmental change, and we encourage you to share this webinar with others in your community, with groups that may be interested in being involved, or just wherever you think it might be useful as you're having these conversations. And I think that a really important component as we're talking about policy change and and making the case for policy change is really being grounded in what the vision for your community is. Because that vision, and I think that we talked about this in October, but that vision is really tied to and what drives the policy priority that you've identified and how you choose to pull that policy lever that we are working so closely with you on.
Good afternoon, everyone. This is Vicki, and Mary and Natasha have asked me to just speak with you for just a minute about the community change framework. And as you know, that's such a key element with this initiative in your policy work. So as I've shared before, and now that all 20 teams are working with the semi-monthly tracking form, this is probably becoming more evident. Many of you will say, gosh, what do we do next? Where do we start? So as you look at this picture, you will see the most evident thing is that there's not a start and a stop. This is not a linear line that's a 1 to 10. So the most, I think, key points here are two. One, look at the actions of your core leadership team, and are they moving so that they work together from one of the components to another, and also look that the arrows are going inward. If your actions are not somehow connecting and supporting and making progress with your policy that you're trying to make progress on, then that's a standalone action. So how can you step back as a core leadership team and see how are the actions we're taking really moving back and forth amongst the 4 components, and also making sure that we're creating progress with our policy priority. The second key point with the community change framework is step outside of the actions of the core leadership team and look at the actions that other coalition members, other allies and partners, community champions, key stakeholders in the media. What actions are those people taking with you and for the work that you're doing on the policy priority? And how can those work together so that organizational decision makers are supporting what you're doing with policymakers? They're helping educate the community. They're helping mobilize others. So it's really twofold. It's the actions of the community leaders, the other members that you're working with, like the stakeholders, and it's your core leadership team, and it's how those actions come together in a very strategic way. When all of this happens together, it becomes the most effective way in moving policy work forward and having the least challenges and pushbacks as you're moving towards that final end goal, the policy. The semi-monthly tracking form, I would challenge you to see it as a puzzle, and that you own the pieces of that puzzle. And as you fit the actions together, then you're going to make the most progress moving forward. So I hope you will continue to see this as a key component in your work with policies.
So as Vicki said, policy change is inherent throughout the entire community change framework, and that is really what you've been charged with, is figuring out which policy lever that you are going to focus on in your community, and with the overarching goal to make the healthy choice the easy choice. And so today we're going to provide you with some talking points as you go out into the community when you get that pushback from community members to say, hey, you know, why can't we just do something? Why do we have to incorporate that into policy change? So I think we wanted to start today by just reassessing or making sure we're on the same page on what policy is. You know, policy, from the way that we're looking at it, is anything in writing, so any written plan or course of action that's designed to influence and determine decisions. And so if you have, this can take a variety of different forms. And as we've talked about with you on our calls throughout the last 8 months, policy can mean an ordinance or a resolution, but it could also mean things like a written plan or an internal governmental policy. It's whatever that governmental entity is using to make its decisions, you want to have a policy, so something in writing to help guide those decisions and influence what people are doing on the ground. So we've actually kind of broadened our circles here to kind of illustrate some different themes that are coming up. So we've been talking about policy systems and environmental change, and that's our focus of this effort, making the healthy choice the easy choice. And we've really tried to draw a distinction between policy change and then programs. And this is a really hard effort to draw that distinction. But what we're seeing is we also have another bubble that we really haven't been talking about or addressing, and that's really of just practices or individual behaviors. So on the continuum, there are these 3 components, and really what we'd like to do, I'll give you a few examples. So for a policy change, it could be an ordinance or resolution, whereas a program is something like a cooking class or a 5K or something that's finite in time and may not be addressing kind of the overarching either a written policy or a systems change. And then for a practice or individual behavior, you might have individuals that are on their own committed to making the healthy choice the easy choice, such as purchasing fruits and vegetables for a meeting for your job or at your organization, but that's just an individual that's taking the initiative to do so. And so what we're really trying to move to is not these three spheres, but a system that actually has the entire framework encapsulated by this policy, systems, and environmental change, so that you have written policies in place that actually impact the systems and the environment, that actually draw and actually guide individual behavior, and actually guide the programs that are very necessary to implement healthy eating and active living or active transportation efforts in your community.
And so I think that one thing that's really important to, just to be able to articulate and that you feel comfortable with is this idea of like, why is it that we care? I mean, what is it about policies and laws that are so effective? And basically we have experience now over the past several decades in seeing how laws and policies can be used to solve public health challenges. I mean, we can go back into the early 1900s and immunization policies around some of these contagious diseases that we as a country have really effectively reined in, and we know that all of the benefits that we as individuals and as communities have as a result of that. Sanitation laws, policies around drinking water and food sanitation and things like that, and more recently laws and policies around tobacco control. We can see that by having laws and policies in place, really significant public health challenges have been addressed, and we as a community have really benefited from that. And I think that what this initiative, the Healthy Communities Initiative, is really focusing on is kind of the new wave of public health challenges that we're seeing related to lifestyle issues with eating and physical activity, or poor eating and lack of physical activity, and the chronic diseases and health problems that are associated with that. And so we know from experience that policies and laws can really be an effective tool to solve these public health challenges. And so in public health jargon, but I think it applies across a lot of different areas, is this idea of policy, systems, and environmental change, that we understand that major health problems and community challenges can really not be solved solely by individual action, that these health problems that we're experiencing and that we've experienced in the past have been heavily influenced by societal policies and environments that promote unhealthy behaviors or fail to foster healthy choices. And that as we start thinking about prevention and taking a more proactive approach, we really need more of an upstream approach that addresses our environments and makes the healthier choice the default.
So many of you have seen probably variations of this pyramid, and the idea is that the further down in the pyramid, the more impactful you have from a population perspective. And so at the very top, you have individual counseling or education to an individual or to a group of individuals, such as a cooking class. And then as you go down the pyramid, you actually have an increased population impact. And so the focus of today's discussion is really, how do we get to socioeconomic factors, the blue factors, is ultimately where we want to have an impact on, but the green, which is trying to figure out the contextual environment where an individual lives, making, again, that the healthy choice, the easy choice, is where our efforts here as part of the HCI grant, that's where that's focused. And so when you're responding to the community on why do we not just want to do individual counseling, you can frame it, if it's useful for that audience, frame it within the context of this health impact pyramid. So we wanted to share this with you and have you use it as a tool for your communities as you move forward. So the reason this is so important, that green area, the policy area, is really these three components. And we're going to talk a lot about them today, and we're going to make them real based on your individual, what you guys are actually working on the ground. But the reality is that when you have a written policy, it helps with that collective vision. And we've spent a lot of time talking about the collective vision and figuring out how your message fits within the vision of your community. So we're not really going to focus on that visioning component today. But I just want to make sure everyone understands writing down your mission or vision is such a useful tool in helping with messaging and helping mobilize and capitalize on a community effort. So I don't want to lose that value of the impact of policy. But we're really going to focus today on the consistency and continuality of the policy and what that does to help efforts to change, make the healthy choice the easy choice. So for consistency purposes, I'll just go back, Mary, sorry. For consistency purposes, what we're talking about is consistency, not just across individuals, but we want to make sure that it's continuous over time. And so it's making sure that the policy is read, even though it's written, is memorialized so it survives beyond the individual. And so now I think we will go on to the next slide, Mary, and really talk about it from the perspective of your healthy eating policies. And then Mary's going to go and talk about it from the bike and pedestrian policy component. So for healthy eating policies, you guys have picked a variety of different policy efforts. One of them is the Food Policy Council. So a handful of you are working on implementing a written policy that has a publicly appointed Food Policy Council. And we've identified 3 key components to a comprehensive Food Policy Council. This is nothing new. We've talked about this before. There's membership, there's mission and goals, and there's responsibilities. So we wanted to show how this works if you didn't have your food policy in writing. Now, I just want to put a little disclaimer out. We have your TA team, which has graciously volunteered their photos. And so these bubbles do not necessarily represent what they think, but it does give you an example. So let's say you have a community that has a coalition of really concerned citizens that are really, they wanted to get together, they formed a coalition, a loosely knit coalition, about impacting their food environment. So that's the same idea of a food policy council. And so they get together, but they don't put anything in writing. They don't put the membership in writing, the goals in writing, or the responsibilities in writing. So we're not going to go through each one of those components, but let's just talk about the goals. You might have Kevin that decides, oh, you know what, I want this group to organize cooking classes. That is really important to me, and that is the goal that I think this group should undertake. Well, Mary's goal, as she's sitting around the table, is really about this group needs to address environmental impacts of farming. You know, that's what's important to me. That is going to be critical in our assessment of the food environment, so therefore that's what this group is going to focus on. And then you have Ron that wants to really focus on having the group increase economic opportunities for local farmers. So you have 3 different individuals around the table, and they all have different ideas of what that group is meant to do. And so you don't have that consistency or continuality as part of that group's effort, and over time that group is potentially could fail and not have that kind of common vision, common goals, and common responsibilities because it's not in writing. So compare that to the group down in Santa Fe who actually passed a written resolution that outlined the goals for the Food Policy Council. So for that collective group that Kevin, Mary, and Ron were on, but this collective group actually got together and they put forth these goals that that group is going to work on. Affordable and nutritious food is provided to all people. It's safe and nutritious and is available to city and county residents. And then finally, that the safe and nutritious food is not limited by economic status, location, or other factors beyond the resident's control. So you can see how, in fact, all three goals of our 3 participants might be encapsulated in these goals listed out. Some of them might not be, but it's a way to actually have that, again, that shared vision, the consistency, and then continuality over the course of time. And so that's why it's so important to write it down so that you don't have confusion among the members. Now compare that to another very exciting policy effort that many of you are embarking upon, which is the healthy beverage policies, or healthy food policies, contracts and bids. But for example, if you were pursuing a healthy beverage policy, we've identified these key areas: goals, pricing requirements, product placement, promotional space, labeling, local purchasing, and arguably most importantly, the nutritional standards. So if you have that in mind, you can have an idea of what happens if you don't have that in writing. And let's just focus in today on those nutritional standards, because I've been hearing several of you struggling with this. So you have community members, and they're on board. The person who's in charge of doing the purchasing, they are ready to implement healthy beverages in their setting, and so they are going to go out and purchase healthy beverages. But no nutritional standards written down. Well, here's what you could have, and this is where another disclaimer. Let's just say that Claudia and Vicki don't have the extensive knowledge and expertise in nutrition, but instead they are in the role of purchasing their beverages for let's say, a park and rec department, and they trade off every other week on who purchases the beverages. Well, Claudia might think that diet soda is healthy because it doesn't have added sugars, whereas Vicki thinks, actually, as long as it's not pop or soda, so as long as it's not fizzy, it's just fine. We can buy that. So you can see, even between the two of them, they might have a difference of opinion. And then Natasha, contrary to all sorts of evidence out there, she has really been taken by the hype of all the advertising by all the professional athletes, and she actually says, sports drinks are the healthiest thing we can get. They help with rehydration. We need to stock up on the healthy beverage, which is a sports drink. And so you can see how there's inconsistency across these different individuals. And so if they were charged with purchasing beverages without written directive, without a written nutritional standard, they would actually have to fall back on their individual expertise. And remember that those people in those positions vary through time. And so, again, you go back to that consistency, and then you have continuality. So it's really important to consider that. So compare that to a nutritional standard that is currently on the books and is being promoted across the country. The National Alliance on Nutrition and Activity has very specific standards on what means a quote-unquote healthy beverage. And so they list out very specifically things about water, milk, and fruit juice. And so this is the list. And what's really great is that, as many of you have Claudia and Vicki are going to be helping kind of hone in on this nutritional standards with you as it relates to your individual policy effort work. But so this is just an example of why policy really matters. It could actually have an important impact on consistency of the people who are purchasing the food, and it actually lasts beyond the individual. So if somebody who has a nutritional background is in a position and then they leave, and then the new person who's in charge of purchasing comes in and they don't have that background, having written standards and having a written policy is critical in the successful continuation of a healthy beverage policy.
Thanks, Natasha. Now we're going to switch gears and use these same kind of concepts as they apply to the different active living around walking and biking that a number of you are pursuing. And so I know that there's a handful of policy initiatives that different communities that have identified, ranging from comprehensive plans to master bike pedestrian plans or councils to design standards to complete streets initiatives, and I think safe routes to school crosswalk policies. So we're not going to cover all of those today, but I want to go through a couple of them just as Natasha did to illustrate how the policy piece is so critical to making sure that you can have an effective intervention in your community that provides that vision, that continuity, and the consistency that policies provide in a way that not having something written down in a policy format just isn't as effective. So let's look at the Master Bicycle Pedestrian Plan as an example. And we went over this in October for those of you that were in my session. But with that plan, there's some key areas that we've identified, and there may be others depending on how your community envisions and implements your plan. But the ones that we've identified are vision, an advisory committee, that the plan clearly identifies strategies and priorities, and that there is a specific resource allocation and prioritization of resources that is included in that plan. And so these are kind of like fundamental components that I would anticipate would be included in some fashion as those of you working on a plan start developing that and getting things in writing. And but as Natasha was saying, that like if you don't have things in writing, you can end up with really different ideas or perceptions from individuals as to what should be included in the plan. And so let's focus now just on the strategy piece. So one of the key components that is part of a Master Bicycle Pedestrian Plan is just kind of the strategies, like what are the strategies, the action steps kind of that are going to be pursued to make this Master Bicycle Pedestrian Plan alive in your community. And if you don't have something written down, you can have people coming up with really different ideas about what they envision a strategy is. So you could have, for example, Amy is really concerned about walking her children to school and is concerned about some of the crosswalks that don't have traffic signals. So for her, a strategy to make her community more bike and pedestrian friendly is to make sure that there's crosswalks with traffic signals at all of these places where she's been walking her kids to school. In contrast, Natasha really sees the idea of the council as and creating that advisory council is a critical piece to make sure that that you have the community input and support behind the plan. While Maggie is a bike commuter, and she really thinks that there's a lot of potential for linking businesses with residential areas through trail networks to increase the number of individuals who are using biking and walking as their means of transportation to get to and from work or to and from shopping districts and things like that. And so while each of these approaches or each of these strategies I think are valuable parts or could be part of a Master Bicycle Pedestrian Plan, each of these individuals are looking at it from a slightly different place. And so if you shift from just having people thinking about what their specific priority is and how you might be able to write things down and have a more of a comprehensive and cohesive strategy for your plan, we can look at the Wichita Master Bike Plan and how they've identified strategies as part of their plan. And I thought it was really interesting looking at this at the Wichita Master Bike Plan, and they had, I think, 30 specific, very clear strategies that they identified that they also not only identified these strategies but also prioritized how they thought each of these strategies should fit into their action plan, looking into the future. And it's very comprehensive. It makes sure that people are on the same page, and I would imagine that each of the ideas that Amy, Natasha, and Maggie from the earlier slide were thinking about might be encapsulated in these strategies, but by putting it down and prioritizing them, then everyone can be on the same page and make sure that you have that shared understanding of what the strategies are. And while the Wichita Master Bike Plan is very comprehensive, I also just want to acknowledge that depending on where you are in your community, your strategies might look different. They might be more global, or you might have strategies that are more focused and don't cover as many areas as what the Wichita plan did. But I think that the Wichita Bicycle Plan strategies really do provide kind of a framework for thinking about how you can write these strategies down as you're and identifying your priorities for a Master Bicycle Pedestrian Plan in a way that it can really take life and get the benefit of what a policy really offers by providing that shared vision, consistency, and continuity. Another area that several of you are pursuing are complete streets initiatives, and I think when I think about the complete streets initiatives, I also think about I think Sedgwick County is pursuing design standards, and there's also another community that's looking at safe routes to school crosswalk policies, and these both can kind of fall within kind of some of the complete streets initiatives that have been pursued around the country. And so as part of the complete streets initiatives, we've seen different different key areas that are included in that, including purpose, which can also be considered as vision, the reach, how far, what is the scope of the policy, responsibilities and implementation, and then the design standards is a key piece that people are pursuing and integrating oftentimes into their Complete Streets initiative. And design standards can be, I guess actually one thing that we're seeing is that some communities are starting with a broader Complete Streets vision, say through a resolution or an ordinance basically providing vision and leadership support for Complete Streets and walking and biking. And then the design standards, while the initial Complete Streets policy may not get into the weeds, get into that level of specificity, having design standards incorporated in some kind of a policy mechanism is a really important aspect to make sure that the Complete Streets effort actually is successful. And so I want to zero in on design standards now and talk about why it's so important that you have a shared understanding that is in writing as to what kind of design standards you're going to use for your Complete Streets initiatives, and make sure that you're all on the same page as far as what the priorities are and what you want your built environment to look like. So, for example, here we have Joyce, Julie, and Kevin, and each of them has a slightly different idea about what they think the design standards for their Complete Streets initiative should include. So Joyce has an idea that there should be elevated pedestrian bridges over busy intersections to provide a safe passage for pedestrians and bicyclists, possibly, so that there isn't that interaction between motor vehicles and people that are walking and biking. And there's design standards that can support that and that can provide specificity as to how you want to identify different intersections where pedestrian bridge would be appropriate, and the construction and design of those bridges. Now, in contrast, Julie has young children, and she likes to walk to and from the parks and schools, and she really thinks that requiring sidewalks on both sides of the street in residential neighborhoods is a very important standard and neighborhood design that should be included in a Complete Streets initiative to promote active families and to make her neighborhoods more walkable and bikeable. So she really thinks that having a design standard for subdivisions and neighborhoods that includes sidewalks on both sides of the street should be a key design standard. While Kevin, on the other hand, really enjoys his biking on the weekends and as a social activity, and so he thinks that having design standards on roads that provide for wide shoulders to allow two bikers riding side by side is an important design standard that should be included in any kind of Complete Streets initiative. And so while each of these approaches is valid, addresses specific concerns, and does, I think, contribute to creating a community where biking and walking is more accessible, safer, and available to people, each of the individuals has a different idea about what a design standard means and how it would play out in their community. So having a specific design standard that you're working with is really important to make sure that you have that shared vision and that you are all working from the same understanding. And so one of the things that we're seeing with Complete Streets design standards is that it is it is an evolving field. I think that one of the things that's so exciting about the work that we're doing together is that we are part of a movement in this country to make our communities healthier through access to healthy food and more opportunities for physical activity. But as with any kind of dynamic process, sometimes what we know today is different from what we may understand is a best practice 2 years from now. And I think that there is a lot of evolution right now in discussions around design standards. But at the same time, there are some real great resources and expert groups that have identified what we understand to be the best practices for design standards supporting complete streets efforts, walking and biking, that are available that communities are using to help inform their implementation of their complete streets initiatives, specifically around how they are designing their streets, their trails, their sidewalks, their neighborhoods. And so I just wanted to provide you with this list of different complete streets design guidelines that were identified actually by the Tennessee Department of Transportation. And I'm not here to advocate that one design standard is better than another, but I think that in Tennessee that they're working with, I think, a mix of these different resources based on what context the community has and what the needs of the community are. Because I do think that different design standards might apply differently depending on if you're in a more rural, suburban, or urban area. And so I just want to let you know that there are a lot of these resources out there, and as you are thinking about your Complete Streets Initiative, or sometimes design standards could be also incorporated into a master bicycle pedestrian plan. It provides that vision and provides continuity and consistency as to how your streets are designed and how you are ensuring that bicycle and pedestrians are part of the makeup and planning and implementation of your community design. So ultimately, the real message here and the goal is behind developing and implementing your policy initiatives is to create stronger and healthier communities. And while individuals may have different ideas about how to do that, by coming together as a leadership team and as a group of interested and invested members of your community, you're moving together as a team towards a shared vision. And your policy mechanism is how you can create that vision, create the continuity, the consistency to make sure that you are actually achieving your goals, creating in your community the vision that you have, and seeing it implemented in a way that is meaningful for you. So we're really focusing on just how policies can be the mechanism that can really help move that forward.
So we're going to go ahead and take some questions from you guys now, but I wanted to definitely highlight kind of the part 2, framing the message, which is going to be on December 11th. And this is really going to take the information to the next level. And it's really, Tammy and Vera are going to talk about communication strategies and how you can use those strategies to engage the community. And they are going to put it in the framework of kind of how you frame messages depending on which area and which audience you are focused on. So this is an example of the senior leadership team, how to frame the messages for the coalition and how that differs, and then key stakeholders in the larger community, including the media. And so really excited for them to build off of the information we provided you today to take it to the level of how then you message to ensure that you're going to have a successful effort with your policy lever. All right, so now we'll go ahead and open it up to questions.
So again, if you'll just enter your questions into the question box, I'll read those, and Mary and Natasha will be able to provide the answers. So far, there's nothing in the question box, though. But any questions, please go ahead. Feel free to enter them now.
And and just for context, I know that the idea, as I mentioned earlier, the idea behind this webinar came from conversations that we've been having with a couple of people and some specific requests for some resources and some tools to use when talking with some of your coalition members, some of your key partners and stakeholders in your community. And one example I know that came up was one community that's working on a, oh my goodness, I think it's a master bike pedestrian plan, was trying to reach out to a local biking group. That I think that this local biking group was kind of a social group that had been really, visible in the community just through their specific activities, and were interested in some different trail networks and some specific projects that they thought would help to create a better biking environment in their community. But they didn't quite understand why policies were important and why the leadership team was pursuing this kind of bigger vision around biking and walking their community. And so we're thinking that and anyway, this community was just asking if there were any resources that were available to help provide that kind of information and framing for this bike group to help message why policy change could be a really effective and meaningful mechanism for that biking group to have a community that was more friendly for biking and supported the group's specific goals as well.
Okay, and we do have a question here, and it's given some of the explanation today, will we be able to continue to narrow our policy goal if we see that it is necessary?
I'll jump in, and Natasha, if you have anything to add. Absolutely. I think that one of the things that, even though I know that we had this kind of push in early September to for communities, for all of you to have identified a specific policy goal that you wanted to work on, we also recognize that as you start working on some of your policy initiatives in your community and start having conversations and working on the community change model and some of the work that Vicki was talking about earlier, that your understanding of the goals for your policy initiative may evolve. I mean, we actually would expect that they would, because you're engaging with people in your community and you are learning with your community about the most effective way to create a healthier environment, be it access to healthy food or better opportunities for walking and biking. So anyway, that's a long answer to your question, but absolutely, and we look forward to talking with you more about your vision and the goals that you are understanding as you continue working with the community change framework in your efforts.
Any other questions out there that we might answer?
And here I'm gonna put a question out there. This is Mary. I guess we just encourage you to think about if there's other questions that you have about how to talk about policy or other examples or tools that you think might be useful for you, because I think until you get out in your community and really start talking about your policy and kind of trying to garner support with different groups, you might not necessarily know what some of the questions or some of the challenges are. So while we're focused on this for this webinar, it's not, if you have questions that come up in the future, it's an open conversation, and we would be happy to provide additional assistance if that would be helpful.
And we do have another question, and it's, is this PowerPoint of this webinar available for our use?
Yes, this webinar will be archived on SharePoint, and I think that Vicki and Claudia are going to talk a little bit more about SharePoint when we're done with these questions. But I mean, our hope is that this webinar is something that you can use. I mean, maybe as a starting point for conversation with different community groups or stakeholders. And I know it isn't as long as some of the other webinars, but we're hoping that actually it might be more accessible by just being a kind of a dive into the conversation so that you can use it, and we encourage you to use it, and the slides will be available.
Okay.
And I think in the past we've actually put a PDF onto SharePoint, and so I think if you, I'm wondering if maybe that question is directed at wanting to use some of the slides in your own presentations, and so instead of having to do a bunch of cutting and pasting of our, I think we could probably make available the actual PowerPoint itself so that you can actually use those slides in your individual PowerPoint slides. So we'll make that happen.
Yes, thank you so much. Yeah, that was the clarification. That was that was the question, you know, just wanting to make sure that they were available, the slides themselves. So great. Any other questions? Well, if there are no other questions, what I'd like to do at this point is to turn it over to Vicki and Claudia to give a little bit more information and to talk about resources. And thank you so much, Mary and Natasha. This has been very helpful. So, Vicki?
Yes, again, thank you, Mary and Natasha. This was very well done and very much appreciated. And just to piggyback on the question that was asked about housing the webinar and the slides, when you go to SharePoint on the home page, clicking on resources, then you will see that takes you to a page that has a folder, HCI webinars. And when we post the webinar link, we also can post the slides. So that's the folder that you would look in, and we've done that with other ones. But always, if we can have the slides from the presenter, we will try to do that. Usually, Elisa provides us the link for the actual webinar within 3 to 5 days after the webinar. So in that way, you can go back and refer to it. You can share it with other coalition members or maybe community champions. Maybe you heard something today you'd like others to hear, and this can be an educational tool for you to provide some communication to others. So it's been said a couple of times already today that December 11th will be our next webinar. And as you know, every month we hold this space purposely for HCI teams. Our intent and purpose is for you to have a time that you know is set aside for education and for networking, for sharing with the whole TA team, and for bringing information via webinar content for you, your core leadership team, but for you to share with others. So an example that I mentioned earlier about not letting actions stand alone, but how do you bring those together in a strategic way, a great example is this November and December webinar series. This is really a two-part series, and it's a TA example of connecting information to deliver the most effective support of technical assistance to you by talking about making the case today with policy and then how to frame that message with different communities, stakeholders, and strategies. So that's just an example, really, of what we're sharing about connecting actions. The other date that I want to mention, and this is very specific to only certain teams, but I just want to make sure that those that are involved did get their invite. Claudia and I will be providing a nutrition standards and how to effectively implement nutrition standards in the Community Change Framework workshop January 21st. It will be in Salina, and that will specifically be for the 5 community teams that are working on vending and concessions policy-related efforts. That's Johnson County, Douglas County, Riley County, Saline County, and Seward County. Those of you that are the key contacts for those teams should have received your invite by email this morning. Any questions that you have can be popped back to me or to Claudia, and we will work with you with any questions you have related to that. Just for the other teams that aren't involved with that, this is an example, though, of how we are going to start in 2014 in doing either regional trainings or policy-related trainings. So stay tuned for those of you that are working in other aspects of access to healthy foods, or those of you working in active transportation, because there will be additional opportunities for you as well. There will also be some trainings that will be for all of our teams, and those will be much more related to the Community Change Framework and communication strategies. So just wanted to reference that, and please look in your inbox if you're one of those 5 communities to make sure you did receive that this morning. I'm going to turn it over to Claudia now. We've been doing a lot of conversation about SharePoint and about resources, and we want to be the most effective technical assistance team as we can be for you. We are here to help guide your work to help you have the best outcomes that you can. So with that said, Claudia is going to visit with you a little bit about SharePoint and a couple of current resources.
Yes, this is Claudia. Good afternoon, everyone. Thank you, Mary and Natasha, for a great webinar, and I know that people will be referring to that often. As you all know, we have had some technological problems with the sharing time afterwards, after each webinar, and we do want to make this as productive for you as possible. So today we're trying something a little bit different. As Vicki said, we want to share some resources with you today and open some discussion about those resources, but also the use of SharePoint. As you know, the TA team receives notices and resources from a number of different sources, including the Public Health Law Center resources that are not a part of the HCI. We pass along any of the resources that we feel could be helpful to your policy work. And SharePoint has been the vehicle. It is developed as a way to really share these resources and as well a way for communities to be able to communicate and network amongst themselves. Today I'm going to share two different resources. One is related to access to healthy foods, and another is related to active living. After I share information about the resources, we invite your thoughts about the resources, but also about the method of creating awareness of the availability of these resources through posting on SharePoint, as well as the ease of use on SharePoint. You can share your thoughts by either typing in a comment as we're talking about the resources or questions, or you can raise your hand and Sean will unmute your line. The first resource that I want to share, some of you may have already learned about if you have alerts set on your SharePoint calendar. It is a webinar that is sponsored by the Public Health Law Center, not as a part of the HCI initiative, but the topic fits very well for those of you who are really working towards access to healthy foods through vending and concession stands. The webinar is titled Boosting Profits, Boosting Health in Food and Beverage Operations, and it's being presented on Wednesday, November 20th, 2013, from 12 p.m. to 1:30 p.m. Central Standard Time. I think that you'll find the information very helpful from the description that we've received. The participants will be introduced to some of the key principles to making food and beverage operations financially successful as well as healthier, with a focus on captive market settings such as recreation center concessions and parks. And the highlights include strategies for managing the food and labor numbers, what it takes to make concessions a healthy standalone business, what items to sell, what items to avoid for maximum effort, looking at the current food trends to adjust concession offerings, how to navigate and direct vendors and suppliers, and special issues around vending machine outlets. So you see it has a lot of application for not only the policy, but the actions of community change framework that is the process for getting the nutrition standards accepted. The presenters for that are going to be Kenny Handler, who is a Profitable Foods Facilities person, and Julie Aoki, who is from the Public Health Law Center, and that some of you at least have met at one of the convenings that we have had. So the link to be able to register to that is on SharePoint, and it is on the SharePoint calendar for the date that it is being presented, which is Wednesday, November 20th, 2013. Now, again, the webinar is posted on SharePoint, and hopefully some of you have set up alerts on your SharePoint calendar so that you can be easily made aware of that through a quick email in your inbox. If you're interested in setting up alerts like this, and not sure how to do that, Adrian is very happy to walk you through that process. And so I invite you right now to either provide comments about the resource, whether you think it might be helpful, or questions that you might have, and also any comments about being able to very easily see the availability of this kind of resource on SharePoint.
And we do have a question. Can other teams come to the Nutrition Standards Workshop even if working on another policy priority?
Vicki, do you want to answer that question?
I'm not sure I can answer that question. I think that's probably a Jeff and Sean question. Mary and Natasha, you may have opinions about this. What I guess I want to say from this vantage point of knowing what the content is going to be is that this is going to be about 4 hours and very specific introduction of the nutrition standards that Claudia and I and Public Health Law Center are recommending that the teams use that are working specifically with vending and concessions. And in addition to those standards, because we don't want the teams to spend all of their time trying to delve through and create standards. So we have a template of what we're recommending that you use, and most of that time then will be spent on how then to utilize those standards within the community change framework to move policy forward. Then when a team is ready, Natasha will work directly with that team in the months to come, whether it's on contracts, language, whatever it needs to be, with those specific standards. So this is very customized for those 5 teams. I'd say if you have interest who this team is, why don't you shoot me an email and let's have this conversation with the foundation. I think that would probably be best. We just don't want to have people attending things that aren't really created for your needs in mind with your policy priority, because then that's not an effective use of your time, and probably each team is going to have something very customized for them in the next few months. So I would say just share that with us, and let's visit with the foundation about it, if that's fair.
That sounds good. We can talk offline about that as well. So that sounds like a good plan. Any other questions? So far, no other questions are showing up in the question box.
Okay, any yays or nays on whether it works for you to get alerts from the calendar on SharePoint?
And no responses are in the question box or the chat.
Okay. So we'll move on then to the second resource. And the second resource is not one that is currently on SharePoint. So I'd like some thoughts about how best to create awareness when they are posted on SharePoint, and the intent is that they will be. The second resource was selected from a series of about 6 AARP resource links that was sent to some of the active living teams by Mary. I have looked at the resources and they are excellent. The 6 include testimony by AARP on vulnerable user legislation. It includes information on guidance for Complete Streets policy adoption and implementation, Complete Streets in the United States, and ideas for beating barriers to exercise. The one of the 6 that I chose for a little bit more discussion and some examples today was a resource that is titled Community-Wide Campaign to Promote Physical Activity Among Midlife and Older Adults, Lessons Learned from AARP's Active for Life campaign, and a synopsis of evidence-based interventions. This social marketing campaign was funded by the Robert Wood Foundation, and it is full of examples and lessons learned, and specifically strategies that were implemented in Madison, Wisconsin, and Richmond, Virginia. The document actually has 5 chapters with over 115 pages. So the chapters include a guide to marketing and communications, a guide to building partnerships, a guide to reducing environmental barriers to physical activity, a guide to community-wide walking campaigns, and a summary of evidence-based community interventions to promote physical activity in midlife and older adults. The one example that I chose fits very well with what Vicki was talking about with regard to the community change framework, in not only working on and paying attention to the actions within your leadership team, but how you can use the work that your coalitions and your partners are doing out in the community to really enhance your efforts. It also very clearly, in my mind, points out the importance of recognizing for all of the actions that you take and all that you collaborate with your coalition, being able to think about in terms of whether the actions that you're taking, the resources that you're expending, are really advancing your policy focus. Or are you expending a lot of resources, people, time, energy, without getting a lot of results? So the one example that they gave in the first chapter of a guide to marketing and communications was that they, in the social marketing campaign, created some messages, and they created visuals with these messages. And with that, they came up with some really great, it seemed to me even, heartwarming pictures of midlife and older people with their families, and some really heartwarming messages. So examples would be of the messages they created. Every bride deserves a dance with her grandpa. And the picture showed an older gentleman shown dancing with his granddaughter at her wedding. Or a picture of a grandmother saying, "I stay active because strong arms give better hugs." So after a while of using these messages, they decided that they would go to the communities and find out from people whether those messages made any difference to them at all. Did they recognize that there was a campaign going any more than they had known before? Or did it cause them to think about some of the active living resources a little bit more within their communities? And they found after discussions that there was no significant difference. So they decided to change their tactic, a lesson learned. And what they did was, first of all, create a walking campaign where they got people really involved in themselves in walking. And then they created some messages, some different messaging, and tested those. And they found out that in combination with that interactive events of getting people actively involved, and the new messages that they found as a part that were more effective as a part of focus groups, that they did have more success. So once again, I think just a really great reminder of the actions that you're taking to make sure that you're coordinating those with others in your coalition, the broader coalition, and that what you are doing is being done effectively. Another example was given, I think, a really great example in the environmental environmental barriers to physical activity chapter. And that one was that, first, keep in mind that their target audience was the older Americans. But one of the lessons that they learned was that children still, even though they were targeting older Americans, children can play an important role in educating both the public and government officials. And so what they found, they looked at what else was going on in their community. They found out that there was a Safe Routes to School type program in their community. And so what they did was they worked with those Safe Routes to School folks And they developed some mobilization that encouraged grandparents to teach their grandchildren safer walking behavior. And they also gave young people disposable cameras to document their walking routes so that they could learn a little bit more and get people a little bit more actively involved. They also had volunteers, older adult volunteers on National Walk to School Day. And so there were a lot of ways that they mobilized the older people in their community to really get active by helping the younger people too. The photos that they gained on that they were able to use in different locations and sites and showing people what was going on with active living in their community. So once again, you know, this is a great resource. It's full of information. I think it's worth your time. And it shows you, I think it gives you a lot of thought about action strategies that have been used, the lessons that other people used, and to be able to apply those to your situations too. As I said, the information is not yet on SharePoint. Our intent is that we will be talking next week. Adrian, Mary, Natasha, Vicki, and myself will be talking next week in what information to present, and also on SharePoint, and then also trying to find ways to make it easier for people to use the resources that we do post on SharePoint. So right now, I invite you to either comment on the resources, whether those examples are something that kind of hit home with you or not, or anything that you want to share related to those examples that you might have experienced in your communities, but also to share any thoughts that you have about what would be easiest or where would be easiest to locate those resources on SharePoint.
And we do have a couple of comments, Claudia, and one of them is it would be a good way to learn about resources, but I need to know how to set up the alerts, and I will get that done. So another comment was, please say the name of the resource again.
Okay. The resource is from AARP. They were formerly American Association of Retired Persons, but they've changed their name now. It's just AARP. And the document is Community-Wide Campaign to Promote Physical Activity Among Midlife and Older Adults. Lessons learned from AARP's Active for Life campaign and a synopsis of evidence-based interventions. So it's a long one, but I do want to say again that we do intend to post this along with those other really great resources that Mary provided on SharePoint.
The other comment is the active living resource sounds like something that would be useful for our team. And then another comment is, yes, appreciate alerts from SharePoint and think that would be helpful. And then another comment was, I also need to learn how to use the alerts. So.
Very good. Dan, I know that in some cases on our individual community calls, Adrian has talked a little bit about helping people with alerts, and maybe that's something that we can plan to do on our individual calls. Adrian, do you have any other thoughts or suggestions about helping people with setting up those alerts?
I could certainly send out a message about how to do it, and also if people just want to email me, it would take maybe 5 minutes to just walk through how to do it. That might be the simplest way to go.
Great. You know, I know myself, I have alerts sent up, and some of them really don't apply to me, but they're just like a very brief email, and you know, I quickly glance at it and quickly delete it if I find that it's not something that's appropriate to me. Maybe it's about another team that that I'm not a provider for. so it's something I automatically delete. But I think you have choices on the things that you can set alerts for, and I do think that you'll find it very helpful.
Another comment that we have is our team learns best from others and enjoys hearing what others have done. So, and we appreciate that comment. And I also would just welcome, you know, any feedback in terms of ways that we can help to make those connections, you know, whether it's during our networking portion of the call or in other ways. So, again, invite feedback, and, you know, you're welcome to post comments here or on SharePoint or in other ways to help us facilitate that.
Yeah, and just to add to that too, Sean, is that we don't want to prevent anyone from sharing any information even on this call today. So we're very open to any kind of sharing or any kind of questions that communities have for each other right now.
Absolutely, absolutely. And another comment, that was part of why the convening was so successful and informative. So.
Great, and I would wholeheartedly support that thought.
And again, I think those regional convenings will be much appreciated as well, it sounds like.
Any ideas out there on how to facilitate that networking time on these calls? Is it sending thoughts or ideas to Sean before we have the networking time after the webinar, or any other thoughts or ideas about how really to make that networking time as productive as possible?
And another question that I would pose in that regard is also just in terms of the regional convenings, if those begin to occur on a regular basis, do you see that meeting the need? So any comments that you have in that regard or any feedback would certainly be welcome. And the comment is lessons learned by other teams would be helpful. So again, you know, if there are lessons learned from other teams that people want to share or post, or, you know, that we have that as a conversation starter, I certainly think that'd be a good idea. So thanks for those comments. And also how to do something. So lessons learned from other teams and how to do something. So we will make a note of that. Another question is, how are you going to use the reports we're going to be submitting? Can we use these as a starting point for networking? And again, from my perspective, I would certainly think so. You know, any things that are seen as a theme or that are coming about that we begin to see as you know, good starting points for conversation, we will certainly do that.
And I would just add to that too, Sean, if there's anything when you're writing your reports, if you're thinking that you would like to share as a lesson learned to anyone else, or that you want to ask questions of anyone else, maybe the time to kind of jot down a note that it's something that you do want to talk about on the networking time, that would be a good time as you're writing your report. And just send that along in an email to Sean, or just plan to have that question or information available during the networking time.
Another comment we have is sharing is great, especially if we can do it face-to-face so that there is give and take. I look forward to more information on the regional meeting. And, you know, and I can appreciate that as well. It's certainly, you know, because of our situation with the phone lines and not being able to have everyone unmuted at the same time, it certainly makes it a little bit more challenging of being able to have that dialogue. So I appreciate that comment. So. we will do what we can to facilitate the networking on all fronts. Any other questions?
Sean, this is Vicki. I wanted to add one more thing about the regional meetings. And the semi-monthly tracking form we think will be a very valuable tool, not only to you all and your work and seeing the overlaps, the gaps, the needs that you have, seeing how your strategies and actions are flowing together, but we will be looking at it from a TA standpoint to help us determine maybe some of the technical assistance that may be needed, whether that's one-on-one work with a team or bringing teams together in a networking format, as you're talking about, with some content delivered as well. So we are excited about those forums and really hope that you see those as a tool for your use, and we feel like it will help guide how we can best assist you with regional meetings in the months to come.
Any other questions or comments? Looks like there are no other questions or comments in our question box at this point. So, Vicki and Claudia, if that is it, I certainly appreciate this information. It's been very helpful. And Natasha and Mary, thank you so much as well. If there are no further questions or comments, I'd just like to thank you all for participating in today's webinar and to wish you all a happy and healthy Thanksgiving. And until we meet again. So that concludes our webinar, and thank you so much for joining.